So what is addiction really? And is it the same thing as dependence? And how is somebody even diagnosed with addiction? I'm Dr. K. I'm a board-certified addiction medicine physician practicing in Cary, North Carolina. And today I'm going to answer those questions and even give you an example where a misunderstanding of this distinction is actually costing us lives. So, how is addiction diagnosed? Well, addiction is really a disease diagnosed based on behavior. And this behavior is the result of alterations in the structure and function of areas of the brain. So there are three main areas that are affected. The first one is your reward cycle, right? This is your reward network. This is what gives you spontaneous feelings of joy when you see your child smile, or when you're socializing with friends, or when you're eating delicious chocolate cake. In addiction, this system gets hijacked by the substance. And so there's decreased pleasurable response to things that would normally make you happy. And instead, your brain starts responding really exclusively to that substance of choice. Somebody may say, well, I need to drink because it's the only way I'll actually enjoy anything, right? That's because of changes in this network. Another part of the brain that's affected is actually the emotional part of the brain. So the amygdala is where fear lives, and anxiety and discomfort, and that feeling that things just aren't right. Well, addiction heightens that. So people tend to have more anxiety. They can become irritable. They have significant discomfort overall. The third change in the brain is actually the balance between the emotional part of the brain and the frontal cortex. This is the part of the brain that we use when we are planning or making decisions. This is the part of the brain that we use when we first decide whether or not to have that beer or that glass of wine. So the balance between the two of them becomes altered in active addiction, where the emotional brain is actually more powerful in a sense, and the thinking brain is actually less powerful. So this imbalance causes really impulsive behavior and makes it really hard for somebody to stick to their promises of not using. So how does this show up in behaviors? Well, in active addiction, the substance or the activity, let's say we're talking about compulsive gambling even, or sex addiction. Well, whatever this is, it's like it takes up all of the mental real estate of the person who's living with active addiction. They are constantly distracted by thoughts of when they can use next. Do they have enough? When is this play going to be over so I can go home and have another drink? This consistent distraction or preoccupation becomes obsessional, and it really squeezes out everything else in somebody's life. We tend to see social isolation. People's worlds may seem to shrink around them, and they withdraw from social interactions, from being at work, even from things that they really enjoy. The other thing that we see is we see continued use despite negative consequences. These negative consequences could even include divorce or losing custody of your kids. There's also risky use. So that's using despite knowing the harm that it's doing to their mental or physical health. All of these behaviors come from those three main changes in the brain that I discussed earlier. Now, what's the difference between addiction and dependence? Well, dependence isn't based on behavior. It's medical or biological. Dependence occurs when the body gets used to having a particular substance in your system on a chronic basis. The body adapts, and those adaptations can actually cause withdrawal signs if somebody stops taking the medication or substance. Examples of this are blood pressure medication. Now, somebody who takes blood pressure medication to manage their blood pressure usually takes it every day. It's a chronic condition that they treat. If they suddenly stop taking their blood pressure medication, their blood pressure is actually going to spike. It may actually be higher than it was when they first started because the body has developed these compensatory mechanisms. So they'll actually become very sick, and it could be very dangerous for them. Somebody who has type 1 diabetes, they're physically dependent on insulin. Without insulin, they can become very sick, and it can even be life-threatening. Now, there are some substances of abuse where you have both addiction, defined by behaviors, and dependence, defined by biological changes. A good example of a substance where there is both addiction and dependence is alcohol. When somebody develops a severe addiction to alcohol, they are drinking it constantly, at least daily. And what happens is that the body makes adjustments based on that presence of alcohol. Now, they also are compelled to drink. They feel like if they don't drink, they can't really function in other parts of their life. They're meeting the behavioral requirements that we discussed earlier. So they have both an addiction and a dependence to alcohol. If alcohol is stopped, they'll go through withdrawal symptoms. And those withdrawal symptoms are related to dependence. They are not related to the behaviors. Another example of that is opioids. So somebody who is on chronic pain medication is going to become dependent on it. That is, when they stop, they may experience withdrawal symptoms. These include headache, nausea, feelings of lethargy, pain. Now, they may experience these withdrawal symptoms even if they weren't actually addicted to the medication. There are people who have severe disorders that require chronic pain medication, and if it's stopped all of a sudden, they will be in a lot of discomfort. Now, people can also get very addicted to their pain pills. Here we see the behaviors that we discussed earlier. Thinking about when they can take their next Oxy or their next Percocet becomes much more important than thinking about what they're going to make for dinner. Actually acquiring the drugs becomes much more important than showing up for their kids. So in both of these examples, alcohol and opioids, you can have both addiction, which is behavioral, and dependence, biological. But it's really important that we don't confuse the two of them. So why is it important that people know the difference between addiction and dependence? Well, because it affects treatment and access to treatment. People who don't understand the difference between the two are less likely to seek treatment and less likely to continue to receive treatment. The biggest example of this is opioid use and the medication Suboxone. So last year, in 2023, over 81,000 people in the United States died from opioid overdose. And some people are actually celebrating that because it's not 83,000, which is what it was the year before. Now, the problem is not that we don't have good treatment for opioid addiction or opioid use disorder, as we call it. The problem is access to the treatment. Barriers that are put up sometimes because there may not be a doctor available or their doctors don't prescribe these medications, but frequently because of stigma from friends and family, and even confusion and internalized stigma for the person who's actually suffering from the addiction. Suboxone is a medication that is actually the combination of two different medications into one. Now, buprenorphine is the component of Suboxone that actually treats opioid addiction. There's another medication in there called naloxone. And naloxone is actually really not well absorbed at all, but it's put in there as a deterrent in case somebody decides to try and cook down their Suboxone and inject it. If they use it that way, they're going to get very, very sick. Now, how does buprenorphine actually treat opioid addiction? It has these unique properties where it's able to kind of trick the brain into thinking that you have the opioids of abuse on board. It binds to the same receptors in the brain, but it doesn't turn them on the same way. So what happens is that the brain isn't constantly preoccupied with when they're going to get their next supply of heroin or when they're going to be prescribed their next supply of OxyContin. Instead, what happens is that buprenorphine sits in the brain in those receptors and it blocks other opioids, which in this case are the drugs of abuse. It blocks them from binding to the receptors. Yet it's tricking the brain and telling the brain that everything is just fine. There are two other FDA-approved medications that can treat opioid use disorder, and those are methadone and Vivitrol or naltrexone. And I'm not going to talk about these during this video, but I'll make a video in the future that really takes a deep dive into all of the different treatment options. Now, Suboxone can also be abused. For people who don't take opioids, if they take Suboxone, they may actually feel a little high. And this is why it's so important for people who are prescribed Suboxone to keep it in a safe place. I almost always require my patients to have it in a lockbox, especially if they have teenagers or people coming into their house that they don't really know. Now, buprenorphine, which is, again, the active ingredient in Suboxone, has been shown to decrease overdose rates by 50%. And what I see people's lives transformed by this medication. They're no longer consumed with thoughts about when they're going to get their next hit. Instead, the buprenorphine kind of smooths things out for them. It actually enables them to just take a once daily prescription and to go on with their life. Now, this is a really good example of the difference between addiction and dependence, because the person who takes Suboxone or buprenorphine will become physiologically dependent on the medication. What that means is if they consistently take buprenorphine and then they stop, they're going to be very uncomfortable, and their body is going to have to adjust, and they will experience withdrawal symptoms. That is not the same thing as addiction. Again, withdrawal is really about biology. It's not about addiction. So what I've seen in people that I've treated with this medication is people being able to get everything back in their life. They reunite with their loved ones. They regain custody of their kids. They get a job and they're actually able to keep it. They are active in their community. They're active in their church. Now, these are behaviors that are actually the opposite of addiction. So why do we have such a high overdose death rate in our country? Well, the reason is barriers to care. Now, it could be that there isn't a doctor who's available or who's trained on how to prescribe buprenorphine, but frequently it's due to stigma. Stigma of family and friends, even internalized stigma, feelings of not even being worthy of finding recovery to begin with. Now, this stigma can actually cost lives. I'll give you a recent example. There's a client I started working with who had severe opioid use disorder, and she actually was being prescribed the opioids. So she was following doctor's instructions, but she developed a very severe addiction. So she came out of detox, and I saw her in my office, and we had the discussion about Suboxone and buprenorphine. And I was actually surprised to later find out that the very people who were working in the detox facility told her that taking Suboxone was just switching one addiction for the other. Now, if I hadn't taken the time to really explore her reasons to be hesitant about Suboxone, I wouldn't have known that. And she may have never actually taken the medication. What I've seen in just a month of treatment is extraordinary. I see somebody who is getting up and socializing and taking care of themselves and taking care of their family. Somebody who's engaged, somebody whose life doesn't revolve around their drug of abuse. This is what I've seen with Suboxone treatment. It's not necessarily the best treatment for 100% of people, but it's a safe and effective treatment that truly transforms lives. Now, stigma becomes internalized shame for people who are taking the medication. People may stop taking their Suboxone before their brain has actually healed, so they still have those changes that we talked about at the beginning of this video. That leads to relapse and sometimes to fatal overdose. So with the knowledge from this video, I hope you feel empowered to make your own medical choices. And if you feel that this video could be helpful for someone else, please share it. If you'd like to see more videos on topics related to addiction and mental health, please subscribe. And if you found this video helpful, I'd love a thumbs up below. I'm Dr. K, and until next time, be well.